Diabetes is a chronic medical condition in which blood glucose levels become higher than normal due to the body's inability to produce enough insulin or use it effectively. Insulin is a hormone made by the pancreas that helps glucose enter cells to be used for energy. When insulin is insufficient or ineffective, glucose builds up in the bloodstream, causing hyperglycemia. Over time, high blood sugar can damage vital organs, including the heart, kidneys, eyes, and nerves. Diabetes is mainly classified into three types: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disorder in which the pancreas produces little or no insulin, often appearing in children or adolescents, requiring lifelong insulin therapy. Type 2 diabetes is more common and usually develops in adults due to insulin resistance, often linked to obesity, sedentary lifestyle, and genetic factors. Gestational diabetes occurs during pregnancy and can affect both mother and baby. Early symptoms of diabetes include increased thirst, frequent urination, fatigue, unexplained weight loss, blurred vision, slow healing wounds, and recurrent infections. Diagnosis involves blood tests such as fasting blood sugar, HbA1c, or oral glucose tolerance tests. Proper management includes lifestyle modifications like healthy eating, regular physical activity, weight control, and avoiding smoking or excessive alcohol. Medications such as insulin injections and oral hypoglycemic drugs may also be necessary. Monitoring blood sugar levels regularly is crucial to prevent complications. Untreated diabetes can lead to cardiovascular disease, kidney damage, nerve problems, eye complications, foot ulcers, and increased risk of infections. Emotional and mental health may also be affected, as living with a chronic illness can cause stress, anxiety, or depression. Preventive measures, including education, awareness, and regular checkups, are essential, especially for those at high risk. Technological advancements like continuous glucose monitors and insulin pumps have improved diabetes care. Proper nutrition, emphasizing complex carbohydrates, fiber, lean proteins, and healthy fats, helps regulate blood sugar, while reducing sugar and unhealthy fats is important. Exercise improves insulin sensitivity, supports weight management, and lowers cardiovascular risk. Blood pressure and cholesterol management are vital for preventing complications. Pregnant women with diabetes need close monitoring to avoid maternal and neonatal risks. Children with type 1 diabetes require careful management to ensure healthy growth. Lifestyle interventions can prevent or delay type 2 diabetes in high-risk populations. Public health initiatives aim to raise awareness, promote screening, and encourage healthy living to reduce diabetes prevalence. Managing diabetes requires a multidisciplinary approach, including doctors, dietitians, diabetes educators, and mental health support. Continuous research and innovation, combined with patient education and lifestyle management, are key to improving quality of life for people living with diabetes. All types of diabetes share the common feature of high blood sugar, but their causes, risk factors, and management strategies can differ. Type 1 diabetes is primarily caused by an autoimmune reaction in which the body mistakenly attacks its own insulin-producing beta cells in the pancreas. People with type 1 diabetes require daily insulin injections or an insulin pump to survive, along with careful monitoring of blood sugar levels and a balanced diet. In contrast, type 2 diabetes is often linked to lifestyle factors such as being overweight, physically inactive, and consuming a diet high in sugar and unhealthy fats, though genetics also play a role. In type 2 diabetes, the body's cells become less responsive to insulin, a condition known as insulin resistance, and over time, the pancreas may not produce enough insulin to maintain normal blood sugar levels. Managing type 2 diabetes typically involves lifestyle modifications, including a healthy diet, regular exercise, weight management, and, when necessary, oral medications or insulin therapy. Gestational diabetes, although temporary, requires careful monitoring during pregnancy to prevent complications for both mother and baby, such as high birth weight, premature birth, or low blood sugar in the newborn. Women who have had gestational diabetes have a higher chance of developing type 2 diabetes later, so regular follow-up and lifestyle management are important. Early diagnosis and proper management of all types of diabetes are crucial to prevent long-term complications such as heart disease, kidney failure, vision problems, nerve damage, and other serious health issues. Education about blood sugar monitoring, healthy eating, physical activity, and medication adherence plays a vital role in helping individuals control their condition. Advances in medical technology such as continuous glucose monitoring and insulin delivery systems have greatly improved the quality of life for people with diabetes, making it easier to maintain stable blood sugar levels and reduce complications. In addition to lifestyle habits, self-monitoring plays a critical role in managing diabetes at home. Using a glucometer or a continuous glucose monitor allows individuals to track their blood sugar levels throughout the day and make timely adjustments to diet, exercise, or medication. Staying hydrated, limiting alcohol, and avoiding smoking are also important for overall health and better blood sugar control. People with diabetes should pay attention to foot care, as high blood sugar can reduce circulation and cause nerve damage, making injuries or infections more serious. Stress management techniques such as meditation, deep breathing exercises, or mindfulness can help prevent spikes in blood sugar caused by stress hormones. Planning meals, understanding carbohydrate intake, and eating at regular intervals support stable glucose levels. Home management also involves recognizing the signs of dangerously high or low blood sugar, such as dizziness, confusion, excessive thirst, or sweating, and knowing how to respond. Support from family, friends, or diabetes education programs can make home care more effective by providing motivation and guidance. Regular physical activity, even in small amounts like short walks after meals, improves insulin sensitivity and cardiovascular health. Importantly, home management should always complement medical supervision. Prescribed medications, insulin therapy, and routine checkups are essential to prevent complications. Combining these approaches empowers individuals with diabetes to lead healthier, more active lives while reducing the risk of heart disease, kidney problems, eye complications, and nerve damage. If diabetes is not properly managed, it can lead to serious and sometimes life-threatening complications over time. Persistently high blood sugar damages blood vessels and nerves throughout the body. One of the most common complications is cardiovascular disease, including heart attacks, stroke, and high blood pressure. Diabetes can also severely affect the kidneys, leading to diabetic nephropathy, which may progress to kidney failure requiring dialysis or transplantation. Nerve damage or diabetic neuropathy can cause tingling, pain, or loss of sensation, especially in the hands and feet, increasing the risk of injuries and infections. Eye problems, including diabetic retinopathy, cataracts, and glaucoma, can lead to partial or total vision loss if untreated. Poor circulation and nerve damage in the feet can result in ulcers and infections that are difficult to heal, sometimes leading to amputation in severe cases. High blood sugar also weakens the immune system, making infections more common and harder to treat. Additionally, diabetes can cause skin conditions, digestive problems, and sexual health issues. The risk of these complications increases with the duration of diabetes, poor blood sugar control, obesity, high blood pressure, and unhealthy lifestyle habits. Early detection, consistent monitoring, and effective management are crucial in reducing these risks. Regular medical checkups, eye examinations, kidney function tests, and foot care assessments are recommended for people with diabetes. Education about symptoms, warning signs, and proper care strategies empowers patients to prevent or delay complications. Advances in medication, insulin therapy, and technology have made it possible for people with diabetes to maintain near normal blood sugar levels and lead active, healthy lives. Mental health is also important, as living with a chronic illness can increase stress, anxiety, and depression, which may affect self-care. A combination of medical treatment, healthy lifestyle choices, and emotional support significantly improves outcomes and quality of life. Preventing diabetes, especially type 2 and gestational diabetes, is possible through healthy lifestyle choices. Maintaining a balanced diet, regular physical activity, and a healthy body weight significantly reduce the risk of developing the condition. Avoiding excessive sugar, refined carbohydrates, and unhealthy fats helps regulate blood sugar and prevent insulin resistance. Regular exercise, even moderate activities like walking, swimming, or cycling, improves insulin sensitivity, strengthens the heart, and helps control body weight. Managing stress through mindfulness, meditation, or hobbies can prevent blood sugar spikes caused by stress hormones. Adequate sleep is also essential, as poor sleep can affect metabolism and increase the risk of diabetes. For those with a family history of diabetes, regular medical checkups and blood sugar screenings can detect early signs of the disease, allowing timely interventions.